Hi, everyone. My name is Lilly Zhang, and this is my teammate, Hennesys Disla. We learned a great deal from Friday's panel discussion regarding pain. 30% of the US population is seeking alternative treatments. 31,000 patients undergo expensive inpatient hospitalizations for pain. We propose the use of virtual reality to treat pain in chronically ill patients, particularly the severely immobile patients at home, so as to prevent costly inpatient hospitalizations. Virtual reality is a technology platform that creates immersive artificial environments. The hardware creates a stereoscopic view, and the software renders the virtual environment. There is a growing evidence of clinical utility for VR in reducing pain. For instance, a prospective randomized trial of 88 burn patients shows that a program called snow therapy can significantly reduce the perception of pain compared to traditional analgesia. The potential clinical impact is huge. We queried the National Inpatient Database for hospitalization costs associated with chronic pain and discovered that it is a whopping $1.1 billion in 2013 alone. If VR can just prevent a fraction of that cost for hospitalization, it will result in huge cost savings. Our product is a VR smartphone app built in C#. This is a screenshot of our simulation of Central Park with its soothing natural environment, and it could potentially transport patients out of their hospital environment, out of their home, and to visit a place where they physically otherwise would not be able to go to. I'm going to set up a demo where I can show some of the functionalities, and Hennesys can talk about our design concepts.
Great, thank you, Lily. All right, so we come from a strong IP position with our clinical background. So we understand that patients have limited mobility. Sorry about that. We understand that patients have limited mobility. We also know the market value, as anyone with a smartphone can experience VR. So we designed our app so when the user can look down at 15 degrees, they can actually move. So it'll move forward. So this is a pre-recorded video of what the viewer would be seeing if they are wearing the VR headset.
We incorporated some sound functionalities as well, and a olfactory cartridge to simulate the smell of pine and grass to present a more fully immersive environment.
Okay. Okay, so just a little bit about the commercial potential. So they consist of two stages. So first is regulatory. So the FDA has recently adopted innovative approaches, and the FDA regulates a small % of mobile medical apps. And we believe that our app would pertain to the enforcement discretion or the non-regulatory requirements would be needed because of the nature of the technology. So regarding scalability, our product is very low cost. The hardware can be as low as $1. The existing app in the App Store is about $1.
Thank you. So the system, the hardware and the software can be purchased for as low as $2, as Hennesys related. And I think our commercialization pathway is a strong one. Hospitals such as Mount Sinai can purchase VR in bulk for the approximately 400,000 patients that it sees as outpatients to treat chronic pain. That will cost about $850,000. If as few as 100 of these patients can avoid a hospitalization, that will result in a cost savings of $4.5 million per year. As we increase our value and iterate on our product, we can adjust our price and increase our revenue for years to come. Thank you very much.
I have a simple mind question. I saw the video, but what is that doing to help the patient? Just very simple. I went through it, but I don't understand what it's doing.
And if you don't mind, I'll just piggyback on that question in the interest of time. The clinical trial that you showed actually was very acute when a person is getting to addressing change. At that time, you were dodging the snow, so you were actually engaging in something and distracted your mind away from the bone changes. So kind of, it's echoing the same point. In this VR mode, how does the benefit comes, especially with chronic pain, was unclear.
Great, thank you so much for those questions. We looked into the scientific background as to how VR exerts its effects. And the gate control theory of pain states that we as humans have a limited capacity to attend to any sensation, pain or anything else. So in order for us to feel pain, we first have to attend to it, to pay attention to it. And what VR does is that it shifts our attention away to something else. It causes a distraction, as Ashish said. So our perception of that pain is mitigated. So it is that distractive effect, and the more immersive and virtual environment that we can produce, the better that effect can reduce the sensation of pain.